Welcome to today's discussion on ureteral atresia, a rare but significant congenital anomaly affecting the urinary system. In this video, we'll explore its causes, how it impacts the body, how it's diagnosed, and the treatment options available. The exact cause of ureteral atresia remains largely unknown, but it's believed to be multifactorial, involving a combination of genetic predisposition and environmental factors during fetal development. Think of it as a developmental misstep, where the ureter, the tube that carries urine from the kidney to the bladder, fails to form completely. While specific genes haven't been definitively linked, research suggests that disruptions in signaling pathways critical for ureteral bud development could play a role. Certain environmental factors, such as exposure to certain medications or toxins during pregnancy, are also suspected, but more research is needed to confirm these associations. Ureteral atresia essentially creates a blockage in the urinary tract. When the ureter is completely absent or severely narrowed, urine can't flow properly from the kidney to the bladder. This leads to a backup of urine in the kidney, a condition known as hydronephrosis. Over time, this hydronephrosis can cause significant damage to the kidney's delicate structures, ultimately leading to impaired kidney function. Imagine a dam on a river. The water builds up behind the dam, putting pressure on everything upstream. Similarly, the backflow of urine puts pressure on the kidney, potentially damaging it. Ureteral atresia is a relatively rare congenital anomaly. Its precise incidence is difficult to determine, as some cases may go undiagnosed, especially if the condition is unilateral, meaning it only affects one kidney, and the other kidney is functioning normally. Studies estimate that it occurs in approximately only 1 in 1,000 to 1 in 10,000 live births. There doesn't appear to be a significant difference in prevalence between males and females, and it affects all ethnicities equally. The signs and symptoms of ureteral atresia can vary depending on the severity of the blockage and whether one or both ureters are affected. In severe, bilateral cases, where both ureters are affected, the condition can be detected prenatally through ultrasound scans, revealing significant hydronephrosis. After birth, newborns might exhibit symptoms such as decreased urine output, abdominal distension, or signs of kidney failure. In less severe, unilateral cases, the condition may not be apparent until later in childhood or even adulthood, presenting with recurrent urinary tract infections, flank pain, or the discovery of hydronephrosis during an imaging study for another reason. Diagnosis of ureteral atresia typically involves a combination of imaging studies. Prenatal ultrasounds can often detect hydronephrosis, raising suspicion for the condition. After birth, further imaging is necessary to confirm the diagnosis and determine the extent of the atresia. This may include a renal ultrasound, which provides a non-invasive view of the kidneys and ureters. Avoiding cystoarthrogram, or VCUG, may be performed to evaluate the bladder and urethra and to rule out other causes of hydronephrosis, such as vesicorectal reflux. In some cases, a MENG3 renal scan, which uses a radioactive tracer to assess kidney function and drainage, may be used. In complex cases, other imaging techniques like CT scans or MRIs might be considered. While ureteral atresia doesn't have distinct classifications in the same way as some other diseases, it's important to differentiate between unilateral and bilateral atresia. Unilateral atresia affects only one ureter and kidney, while bilateral atresia affects both. Bilateral atresia is obviously more severe, as it compromises the function of both kidneys. Also, the location and extent of the atresia can vary, affecting the presentation and treatment approach. The primary goal of treatment for ureteral atresia is to relieve the urinary obstruction and preserve kidney function. The specific treatment approach depends on the severity of the atresia, the age of the patient, and the presence of any associated complications. Surgical intervention is almost always required. Common surgical procedures include ureteral reimplantation, where the ureter is reconnected to the bladder in a more functional manner, or creation of a pyelostomy or nephrostomy, where a tube is placed directly into the kidney to drain urine. In some cases, reconstructive surgery might be necessary to create a new ureter. Post-operative care includes monitoring kidney function and preventing urinary tract infections. Currently, there's no known way to completely prevent ureteral atresia, given its presumed multifactorial etiology. However, pregnant women can take steps to minimize potential risks to fetal development. This includes avoiding exposure to known teratogens, maintaining a healthy diet, and receiving appropriate prenatal care. Genetic counseling may be considered for families with a history of congenital kidney or urinary tract anomalies, although the precise genetic risks are still under investigation. The prognosis for individuals with ureteral atresia depends on several factors, including whether the condition is unilateral or bilateral, the degree of kidney damage present at the time of diagnosis, and the success of surgical intervention. Unilateral atresia, particularly if diagnosed early and treated effectively, often has a good prognosis, with many individuals leading normal lives. Bilateral atresia carries a more guarded prognosis, as it can lead to chronic kidney disease and potentially require dialysis or kidney transplantation. Ongoing research is focused on understanding the genetic basis of ureteral atresia and developing less invasive surgical techniques to improve outcomes. Furthermore, advances in fetal imaging are allowing for earlier diagnosis and potentially earlier intervention in severe cases. Thank you for watching.